My name is Dr. Morris Tobin. I'm a nephrologist who's been practicing in Northeast Texas for the last 35 years. I ran an inpatient hospital dialysis program for 35 years. I also ran an outpatient dialysis program for 32 years. And I have extensive experience with inpatient hemodialysis, home peritoneal dialysis, and home hemodialysis. Dialysis is a tremendous stress on the patients, especially if you do a hemodialysis. It's not unusual for the patients to feel tired, and actually it takes them almost 24 hours in some cases to rebound from the treatment. Just about the time that they feel like their own selves again, they have to go back and have another treatment. The patients who get to the dialysis unit do have a waiting period before they can get on, and then once they are on the machine and afterwards, that takes a certain period of time for them to get off. So basically we're talking about a 4-hour treatment 3 times a week that'll actually take up the whole day, because it's an hour or so getting them on, an hour or so getting them off. And if they're not stable, they have to wait a little extra before they can go home. So we're talking as much as 6 or 7 hours that are taken out of a single day for their treatments. There are 3 other alternatives. They're all home-based. One is a home peritoneal dialysis program. A second alternative would be a home hemodialysis program, where the patient will run their own treatments at home, usually the help of a spouse. And the third alternative would be a home nurse-assisted dialysis program, where the patient would be dialyzed in the home by a dialysis nurse with the equipment there, and the patient would just have to be on and then be disconnected afterwards. If it were hemodialysis at home, there would be learning actually basically what a nurse who's been trained in dialysis has to do. The major difference is the equipment that is used for the home hemodialysis, where the patient runs it, is not quite the same equipment that we use for the in-center hemodialysis and the home nurse-assisted. So the equipment is a little simpler to use and not as difficult to master. But at the same time, there's a lot of stress associated with that. The home hemodialysis had been around for a long time. The track record was bad because of the fact there was so much stress on the spouse that we had to stop that. So there is a certain psychological stress associated with a spouse running dialysis, or the patient running dialysis on their own, with the spouse assisting her. That is basically exactly the same of treatment that you would get if you went to a freestanding outpatient hemodialysis unit. The only difference being is that you would have this done in your home. So you'd have the convenience of being in your lounge chair or a dialysis chair, and the nurse will come and you would be dialyzed there, and then you would be done for the day. And also the advantage is you have a one-on-one experience with one nurse to one patient. In a dialysis unit, the requirements in the state of Texas are 1 RN for every 4 patients. So therefore you're not going to have the same ratio of nurses to patients in an outpatient facility as you would in a home nurse-assisted program. What has been done is we provide all of the necessary equipment for the patient. The dialysis machinery, the dialyzers, the water supply system, which we technically refer to as an RO system, which purifies the water for the dialysis treatments, plus the backup of the technicians and the trained personnel to make sure that the machinery is quality cared for, and also the water treatments are carefully monitored. The home programs are really appreciated by people who are want to run their own situation, or as we are having with our patients, who are not capable of going to an outpatient hemodialysis unit because of their underlying medical problems. And because of that, they're given an opportunity to receive dialysis, which would basically minimize their time spent, which would help with their schedules, and at the same time offer a service that would help patients who have been ill, who for one reason or another are unable to go to a outpatient dialysis program. The advantage is that you are getting professional care in the home situation, and that's why I refer to it as the Cadillac of hemodialysis. We have, as required by the state, have a social worker and a dietitian, and we have a governing board, and we meet every month and discuss our patients and their outcomes. So it's a team effort. There would be no difference in the rapid response in the home situation versus the dialysis situation. In both situations, if there was an acute emergency, the patient would have to be taken off the machine right away. And in any standard dialysis unit, what they will do is call EMS to come. Therefore, the same thing would be here in the home program. They would call EMS to come to transport the patient. If the patient had a cardiac arrest, nursing personnel have been trained in responding to that situation. This is a personal decision, but there have been several surveys of nephrologists. And these surveys have asked, if you needed dialysis, what would you take? And the last choice for all the nephrologists, I think it was 95% or 91%, would not take hemodialysis in an outpatient situation. That was something that they would like to avoid at all circumstances. The first choice among nephrologists would be a home program of one sort or another.